This message, getting your flu vaccine is more important than ever this year. 20 million more vaccines will be sent out compared to last year. Doctors say getting the shot is so important because hospitals have been so overwhelmed with coronavirus cases. They might not be able to handle an influx of flu patients also.
San Francisco International Airport is the first in the country to deploy rapid coronavirus testing. Right now, it's only available for employees and flight crews. But get this, it takes only 13 minutes or less to get your results. The program could be expanded to travelers, but the priority right now is for employees. Well, here's a look at the latest COVID-19 numbers released by the State of Washington Health Department. In our state, more than 71,000 confirmed cases. That includes 334 new ones. The state has 1,876 deaths, which include 9 new deaths. And keep in mind, the state says more than 1.3 million people have been tested so far statewide.
Time now for HealthLink. As the debate rages on over whether to open schools or when, we're learning more about the actual risk to teachers and other adults who live or work with children, thanks to a mind-boggling amount of information collected from people across the nation. So this massive data mining operation was taken on by researchers at Harvard University and New York's Hunter College. They used data from the 2018 National Health Survey, along with criteria from the Centers for Disease Control, which identify people who are, quote, at risk. Well, here's what they found. 2.3 million teachers and 28.6 million adults are either in their 60s or have a chronic disease that makes them a prime target for a severe case of COVID-19. The research published in the Annals of Internal Medicine also shows that the risk was the same whether the children were kids or teens. And overall, their discussion stated that 40 million adult Americans living or working with kids have a definite or at least very possible risk of getting the disease. An important number to have on hand when making the call before ringing the bell.